walk past the common sleep shelf, and GABA capsules talk as if they bottle the brain's main brake pedal for stressed adults. The marketing story is almost childishly simple. Put more inhibitory neurotransmitter in, get quieter nerves, and deeper sleep out. The scientific story is messy, because oral exposure in the gut, peripheral nerve sensing, and true central GABA, tone inside protected brain circuits, are not interchangeable delivery paths, even when the molecule name on the label matches the classroom neurotransmitter exactly.
If that bottle is selling 30-minute calm, what exact journey is it claiming from swallowed capsule to a quieter brain circuit?
GABA, gamma-aminobutyric acid, is the primary inhibitory neurotransmitter neurons used to reduce excitability and keep circuits from overfiring. That classroom neuroscience is not in dispute across basic physiology. What is disputed is whether swallowing a supplement dose meaningfully raises that same signaling inside protected brain networks, or whether any felt effect happens through peripheral sensors, enteric nerves, immune tone, or slower gut-brain routes instead of a direct cortical flood of free GABA from the capsule. After you swallow it, the capsule meets intestinal tissue first, long before any romantic brain scene. Local receptors, immune messengers, and microbial neighbors can respond before any molecule ever negotiates the blood-brain barrier. So a change in gut comfort, mild body relaxation, or evening settle down can be subjectively real without proving the capsule poured free GABA into cortical synapses the way a prescription central nervous system drug would.
That barrier question is everywhere in viewer comments and videos. Does oral GABA mostly fail to cross into the brain, or is the older absolute line that it cannot enter simply oversimplified by newer peripheral explanations?
The responsible summary is unresolved exposure, not a clean yes or no for shoppers. Conventional pharmacology still expects poor direct brain entry for GABA itself. Human studies report scattered symptom or biomarker signals, but many of those signals are compatible with peripheral receptors or gut-mediated pathways rather than synaptic reloading. Treat barrier crossing like a sedative as an unproven leap, especially when sleep marketing outruns the available sample sizes and controlled study designs. Even before we grade efficacy, combinations matter for real-world use. Stacking a calming capsule with alcohol, benzodiazepines, sleep drugs, or other sedatives can amplify drowsiness, slow reaction time, and muddy next morning alertness. That practical hazard exists whether or not the product truly floods brain GABA receptors the way influencers imply on thumbnail art.
Then why do so many supplement videos treat GABA like a reliable sleep or focus stack? When GABA actually appears in randomized trials, what were those protocols really testing, and how strong was the signal?
A 2025 systematic review of nutritional supplements for esports performance gathered 13 randomized trials and 466 participants across cognitive, mood, and gaming endpoints. Most protocols were pure caffeine or caffeine blends. GABA appeared among secondary active substances, and the authors warned about heterogeneity, risk of bias in over half the research, small samples, and mostly amateur players. That is a thin base for telling ordinary adults that an oral GABA capsule will calmly renovate sleep or focus on demand.
Is there any cleaner human signal for an actual GABA capsule in this packet, even if the endpoint is not magical sleep?
Yes, and the cleaner capsule signal sits in the gut rather than in dream architecture. In a 2026 randomized, double-blind, placebo-controlled crossover pilot, 20 adults with diarrhea-predominant IBS took oral GABA across 2 4-week periods with washout. About 2/3 met a clinical response threshold on the IBS symptom severity score during GABA versus 1/3 on placebo. Emotional limitation quality of life improved, interleukin beta fell, lipopolysaccharide binding protein trended downward, and stool microbiota barely remodeled. That is useful for IBS-D biology and mood-linked gut distress. It is not proof that the same capsule sedates the sleeping brain. Buying in safety context still follows NIH Office of Dietary Supplements and FDA consumer framing. plus size plain warning that supplement evidence varies widely by ingredient. Retail products may differ from study products in dose, fillers, and purity, and supplements can interact with medicines or complicate surgery plans. A neurotransmitter name on a label does not convert the capsule into an approved anxiolytic or insomnia medicine with dosing certainty. Also, keep oral capsules separate from microbial GABA production when you read sleep headlines. In a decentralized, randomized trial of adults with sleep disturbance, Lactoplanobacillus plantarum LP815 improved insomnia severity index scores, reduced anxiety symptoms, increased objective sleep duration, and raised urinary GABA during the first week of use. That supports a gut-derived GABA story with measurable systemic traces. It does not automatically validate every store-bought GABA powder sold for instant calm.
Who should not casually self-experiment with oral GABA, and which medications or life stages should push this decision to a clinician before the first capsule?
Pregnancy, breastfeeding, active psychiatric medication changes, and significant blood pressure instability belong in a clinical conversation rather than an aisle experiment. People already using central nervous system depressants should assume additive sedation risk until a clinician says otherwise. Lightheadedness, excessive sleepiness, or next-day fog is a stop signal, not a cue to double the dose in hopes of forcing a stronger brain affect the evidence never promised. So who might still run a cautious personal trial without pretending the science is settled? Best fit experimenters are adults with mild tension or gut-linked discomfort who will track boring outcomes for 2 full weeks. Sleep latency, night wakings, daytime fog, or IBS symptom scores against their own baseline. No clear change means stop rather than escalate milligrams. Keep expectations below the marketing claim, because oral GABA's brain delivery remains uncertain and the calm sleep evidence base is still small, mixed, and easy to overread from adjacent gut findings.